the patients with inhibitor are associated with a higher rate of disease-related complications, so these patients are facing with a higher rate of morbidity and mortality. So all of this can impact on their quality of life. Our aim is to improve their quality of life because they have multiple events of hematrosis, muscle hematoma, and deep bleeding into the tissues. So this all can cause decrease their quality of life, and we need to have a proper and timely management of these patients with inhibitor to increase their quality of life. The inhibitor developments in patients with hemophilia is not very common, but it can happen in about 30% of patients with hemophilia A and 3 to 5% of patients with hemophilia B. In general, when a patient develops inhibitor, replacement therapy would be ineffective. So we need to find some other ways to treat these patients. And these patients with inhibitor can come to our clinics with severe bleeding episodes, and this causes them to have a decreased quality of life. So I think that we need to consider these patients for increasing their quality of life by providing the best optional treatment for these patients. The best strategy, the first thing is to evaluate that what's the level of the inhibitor. We have two kinds of inhibitor levels. The first is less than 5 beta unit, or patients with patients presenting with higher level of inhibitor development, above 5 beta unit. For patients present with low titer, low beta unit less than 5, the best option is to give a higher concentrate or higher dosage of the factor VIII concentrate or factor IX concentrate. But for patients with high titer, above 5 beta unit, the factor VIII concentrate, the factor IX concentrate would be ineffective. And we need to use bypassing agents like factor VII, recombinant factor VII, or FVIII, factor VIII inhibitory bypassing agents. So recently also there are some novel therapies which comes to our clinic, and it's called Emicizumab, which is a monoclonal antibody, and it acts as a bridge between the factor 10 and factor 9. So it is a revolutionary, I think, treatment in patients with inhibitor, because this monoclonal antibody just can use as a subcutaneously once per week, and no need to give any infusion of factor concentrate or factor 7 or FVIII. And also it was approved by FDA and EMA. So we have different options. Bypassing agent as the first option is available. We can use it, and then if also we have a novel therapy like Emicizumab, in some centers it is not worldwide available of Emicizumab, but if it is in this novel therapy is available, we can use Emicizumab in patients with inhibitor. And definitely several studies show that this novel therapy as Emicizumab can increase quality of life of the patients with inhibitor. So my recommendation is the first option, yes, we can use bypassing agent, and the second option, if it is available, we can use Emicizumab for patients with inhibitor. And many studies recently show that this novel therapy can increase significantly quality of life. Yes, and the other thing that we have to also improve the social environment of these patients, and as well as proper and timely management. And if we consider all of this issue, definitely we can increase quality of life, because several tools are used to evaluate the quality of life of these patients, and one of them is short form 36 questionnaire, and also many studies using these different tools showing decreased quality of life in patients with inhibitor. So in improving their social environment by providing, for example, any employment or any other advertising, and also providing the proper and timely management of these patients using bypassing agent or novel therapy like Emicizumab definitely can increase their quality of life.